Um, Welcome everybody. I'm Julian Baggini. I'm going to be chairing this event today, Bristol Festival Ideas, Festival of the Future City. You're probably aware, incredible programme over the next 2 days, and this I think is bound to be a highlight of it. We're here with Michael Marmot. He's the director of the Institute of Health Equity at UCL still. Yep. And he's got numerous positions. I mean, I can't list everything. He's knighted in 2000 for his services to epidemiology, understanding health inequalities. He chaired the World Health Organization's Commission on the Social Determinants of Health. And he's also conducted similar reviews and reports for national governments, including the UK and the EU. And he's currently just started serving as a president of the World Medical Association. So basically, if you want to know about the social determinants of health, this is the man to listen to. He's just published a new book on the subject, which brings together, it's called The Health Gap, brings together so much of the evidence, applies it across a huge range of things. It really is a definitive text on this subject and extremely readable to boot. Strongly recommend it. It is going to be on sale afterwards, down the corridor at the other end. But what we're going to do now is that Michael's going to talk to us for about 15 minutes perhaps. We'll have a small conversation here and then we'll open up to you. And we do have to finish quite promptly because of the number of events going on today. So if you could begin just by welcoming Michael Marmot.
Chapter 8. Anybody can start at chapter 1. In May 2011, Mary hanged herself. She was found in the yard of her grandparents' house on a First Nations reserve in the province of British Columbia in Canada. She was 14. She was a First Nations Aboriginal Canadian. Her story has particulars. All suicides do. She'd been physically and emotionally abused and possibly sexually abused. Her mother was mentally unstable. Officials attributed what happened to Mary to failures in the child protection system. But there's another way to look at Mary's sadly foreshortened life. And that is to realize that though her personal tragedy was unique, there are many young Aboriginal Canadians who experience similar tragedies. In fact, the Aboriginal youth suicide rate in British Columbia is 5 times the average for all Canadians. When researchers looked at this question, they said that there were about 200 bands of First Nation groups in British Columbia. They were all in poverty, bone-grinding poverty. But in the first 6 years they studied them, 90% of the suicides occurred in 12% of the bands. And the question is, what distinguished those groups that had these tragedies from those that did not? They looked at empowerment of the community. They measured empowerment by the degree to which communities were involved in land grants, land claims, whether they controlled the fire and police and education and health services, and some measure of cultural continuity. And what they found was a graded relation. The more of these cultural and social factors present, the greater the empowerment of the community, the lower the youth suicide rate. In those communities that controlled all of their affairs, there were none. No Aboriginal suicides. Empowerment of communities, key. I mentioned Mary's story for a couple of other reasons as well. One is to emphasize the importance of mental illness, that my concern with inequalities in health is not just with physical health, but with mental health as well. and also to emphasize the issue of violence against women. Violence against women can be fatal. Women get killed by their violent partners. They're driven to suicide, and there's great damage to mental and physical illness. Chapter 9. There is more in Chapter 8, by the way. I didn't read all of it. Chapter 9. In January 2010, Haiti's earthquake wreaked havoc, and 200,000 people died. Less than 2 months later, a quake 500 times stronger than the Haiti quake hit Chile, and the death toll was in the hundreds, not in the hundreds of thousands. Chile was well prepared in every way. Strict building codes, good emergency services. Haiti was underprepared in every way imaginable. In the first few hours after the Chile quake, President Bachelet was out on the streets supervising the relief organization. In the first 24 hours after the Haiti quake, nobody knew if the president was alive or dead. Earthquakes do not kill people. Falling buildings kill people. It's the organization of society that determines whether a natural phenomenon will become a natural disaster. And I talk a great deal about society and the organization of society. Given the theme of this conference, that can be at the national level, at the city level, and indeed at the community level. I was in the US earlier this year, and I was about to give a talk on what I do when Baltimore erupted. The precipitant for the eruption in Baltimore was the killing of a black man in police custody. That was the precipitant. It was not the cause. The underlying cause was inequality. Because when I say Baltimore erupted, I'm being a bit crude. In fact, it was an area of downtown Baltimore, which I had written about in my book. I contrasted two areas of Baltimore, the one with a life expectancy for men 20 years shorter than the rich one. And I describe it in Upton Druid Heights, the poor area. Household income in 2010 was $17,000 was the median. In the rich area of Roland Park, it was $90,000. And you can write the script for the rest of it. More than half in Upton Druid, single-parent families. Almost no single-parent families in Roland Park. In Upton Druid, reading skills in school were low, very few kids going on to college. Roland Park, reading skills are high, the majority go on to college and complete college. In Upton Druid, the homicide rate was 40 per 10,000, and in Roland Park, it was 4 per 10,000. In Roland Park, they stay out of the clutches of both the police and the gangs. And sometimes it's hard to tell the difference, but in Upton Druid, they fall into the clutches of one or other or both. And there's a 20-year gap in life expectancy. Is what I'm saying about Baltimore ringing any bells? In 2011, when the London urban riots broke out, they began in Tottenham. I had been showing figures that Tottenham had the worst male life expectancy in London, about 17 years shorter than the best. What a surprise, what a coincidence that the riots broke out in the area of shortest life expectancy, not in Kensington and Chelsea. They didn't riot outside Harrods. They rioted down at Hill Tottenham. And you'll remember, as if some ghastly coincidence, that the precipitant in Tottenham was the killing of a black man by the police. God, this sort of cosmic, ghastly joke or whatever is going on. But again, the underlying cause is inequality. Now, you might be concerned. Think about your own attitudes to the poor. I've talked about the poor of Baltimore. I've talked about the poor of London. I write a lot about the poor of India. And you think to yourself, that's not me. And depending on your political attitude, you might think that the poor are architects of their own misfortune. They are feckless, irresponsible. They wouldn't be poor if they were not. And so they've only got themselves to blame. Or if you're of a different political persuasion, I'm sure what I just said doesn't sound familiar. None of our politicians would possibly say anything like that. Or if you're of a different political persuasion, you think it's a shame on a civilized society of a rich country that we should have people living in that kind of poverty with inadequate shelter, going to food banks and the like. But either way, whichever view you take, you think, that's not me. I'm not poor. I may not be rich, but I don't go to food banks and I'm not at the bottom. So what this chap is writing about doesn't affect me. Wrong. It affects you and it affects me. Because there is what I call a social gradient in health. If you classify people by education, by income, by the affluence of the area in which they live, what you find is people near the top have worse health than people at the top. People in the middle have worse health than people at the top, all the way from top to bottom. And I calculated for England, people in the middle, let's roughly say you and I are in the middle, roughly speaking. Don't ask me where the definition is. Everybody below the top and above the bottom. Below the top 10% and above the bottom 10%. So take the middle of the middle. On average, you will have 8 fewer years of healthy life than people at the top. By 8 fewer years of healthy life, I mean earlier onset of declining grip strength, of difficulty with walking, of declining cognitive function, and fewer years of life. We calculated that if everybody in England had a mortality as low as the top 10% based on education, there would be 202,000 fewer deaths each year. 500 a day. And I think, based on the evidence, that that is unjust. That's wrong. Why are we not out on the streets campaigning? Stop the injustice now. Because the reason I wrote the book is I think we know what we need to do to make a difference. And it goes through the life course. It starts with early child development, education, the quality of working conditions, conditions for older people, action at the community level, at the national level, and the global level. We really know what to do to make a difference, but we have to want to do it. So this book is based on the best science that I could accumulate. I've been doing research on the topic my whole life. In chairing these various commissions, I had scores, if not hundreds of scientists bringing the evidence to us. We synthesized it. So it's based on the best evidence. And let me give you one example of how policy and political considerations abuts against the evidence. I think early child development is vital. I call it equity from the start. The time to start is at the beginning of life. And what we see, what the data show us, is a social gradient in early child development. That means cognitive and linguistic development, IQ, social and emotional development, and behavior, social gradient. The higher the income of parents, the better the kids do. At age 5, a higher proportion of children are ready for school if they came from high-income parents than from middle, and the middle are doing better than the ones at the bottom. It's graded. Now, when you look at that graph, it's almost like a political Rorschach test. The right say it's poor parenting. The left say it's poverty. And I say they're both right. They're both correct. Because the ability of parents to parent is influenced by the social conditions. A parent, think of the bottom of the gradient, a parent that is worrying how to make ends meet, that hasn't got proper living accommodation, maybe in temporary accommodation with children, may not have a book or a bed to read children bedtime stories. Are you going to blame that parent for being a bad parent? You're going to blame the fact that they don't have somewhere to live and they don't have enough money and they're worried by all those things and possibly suffering from postnatal depression. So yes, bad parenting, quote unquote, is very important here. But bad parenting follows the gradient. And it's not because people choose to be bad parents. It's because their ability to do all those nice things of reading and playing and singing and all those things that have a positive impact on children are influenced by where they are in the social hierarchy, by the social and economic pressures on them. And the same argument applies when I look at education, when I look at employment and working conditions, when I look at the conditions for older people. So having said that early child development is vital, I do not for one instant think that we should throw today's older people on the scrap heap. I have a vital interest in this. You and I may share an interest in this. And I quote Maria from Brazil, age 90. And she says, if the bus would stop closer to the curb, it would be easier to get on the bus. I found that I was falling when I went out on the streets because of the uneven footpath. And she actually went to classes about anti-falling. Another way might be to fix up the sidewalk. She said that when they subsidized public transport and entrance to the theatre, we could participate. So you can, right through the life course, there's a great deal that we can do. And the evidence shows, and let me finish here, I wanted to call my book The Organization of Misery. I quote from a wonderful poem by Pablo Neruda, who said, "Rise up with me against the organization of misery." Wonderful. And so I wanted to call, but Bloomsbury, the publisher, said, you can't call a book The Organization of Misery. I said, okay, can I call it The Organization of Hope? Well, it's a bit better, but nobody will have a clue what you're talking about. So my compromise was to call the first chapter The Organization of Misery, because I document all the inequalities in health going on around the world, and it's pretty miserable. But I call the last chapter The Organization of Hope, because they are inspiring examples from around the world of people making a difference, of triumphing over adversity, and really showing the way that we can create a more fair and more just society.
Thanks very much, Michael. Let me pick away at this a little bit, because the headline people can take away is that inequality basically has outcomes. You plot a graph of health outcomes and income equality, and it's really clear there. But I think people will wonder, well, why is that? Now, some of the factors are obvious, namely that if you're less well off, you have less access to healthcare, good food, good housing, paying your heating bills. But that doesn't account for all of it. But also, some of the things you mention don't seem to have anything directly to do with inequality in that financial sense at all. So, for example, you said, I think, a really striking thing. One of the things you're hugely in favour of is education, and in particular women's education. And you say a mother's education is a much stronger predictor of infant mortality than is household income or wealth. So when we're asking, well, what is it about inequality that sort of leads to these bad health outcomes? It's not the mere fact of inequality, is it? What are the other factors? Some of the other factors, there's going to be too many to go into, other than the straightforward ones around resources.
Well, let me perhaps start with that by the quote that I take from Amartya Sen. And Amartya Sen, Nobel Prize-winning economist and philosopher, says that inequality with respect to income translates into relative inequality with respect to income translates into absolute inequality with respect to what he calls capabilities. And the way I translate that into English is to say it's not what you have, but what you can do with what you have. So that the amount of money that you have is only relevant insofar as it translates into what you can do with what you have. So let's take your example, your question of education. I think education is important in two ways. One is a direct causal effect. So I think that the reason mothers with more education all around the world have babies that are more likely to survive the first year or the first 5 years of life is because mothers know what to do. They're educated and they figure out you've got to have clean water and adequate nutrition, and they know what to do. If the baby gets sick, you take the baby to hospital and so on. I think education is causal. I think education for women is causal when it comes to fertility. The fact that women with more education in general, around the world, have fewer babies, and that if you're worried about population explosion in India and Bangladesh, look at education and fertility. In Bangladesh now, the women with more education have 2 babies. Don't worry about, family planning is helpful to have access to contraception if you don't have a baby, but it's not just the contraception, it's the education of women making those choices about what they want. And I think education is probably causal when it comes to reducing domestic violence. Women with more education are less likely, and I have a table in the book, are less likely to endorse the proposition that it is acceptable for a husband to beat his wife if she refuses to have sex with him. Particularly in sub-Saharan Africa, a majority of women endorse that ghastly proposition. But the more education, the less likely are women to endorse that. And I say that when you get involved in global health, the first lesson is to be culturally sensitive. But I think the right of women to be treated as human beings has to trump cultural sensitivity. So I think education is key there. Now, when it comes to adults and their own better health, then I think education may be indirect as well, because more education gets you a better job, so that stress at work, which can damage health, and my chapter on work starts with the most ghastly working conditions that clearly can damage health. More education, you're less likely to be subject to those ghastly conditions. More education, you get better income, you live in a better place. And then in addition, there are these cognitive skills. So when The Guardian says next week the watercress causes cancer, and the week after they say coffee's bad for you, and the week after that they say coffee's good for you, and so on. You can sort this stuff out. You can sort out the nonsense that gets thrust at you all the time, and you can be more sensible because you've got good education. So I think education gives you these general skills, but it also gives you access to better work, more money, better neighbourhood, and the like.
But I mean, I'm wondering from a political point of view how important it is to understand that the key thing, as you said, quoting Sen, it's about your capabilities at the end of the day, what you can do, not so much what money's in your pocket, but what you can do with it. Because politically, I mean, the most straightforward sort of answer to your challenge would be, okay, greater redistribution, a higher taxation for the rich, more benefits for the poor, higher minimum wage, a lot of things I imagine you would approve of. But isn't there also scope to do quite a lot of things which have nothing directly to do with income at all? You can provide people for resources, for example, free healthcare, free education, free travel on buses. So I mean, it's not a kind of we don't have to choose between. It's not that the only way to deal with this is a high tax, high benefit culture, which the government is not keen on.
I think the high tax, high benefit is a means, not an end. And particularly, I was in the US last week and being asked on public radio, but Americans are intolerant of high taxation. And I said, if you look at child poverty, where poverty is defined in a relative way, less than 60% median income, the US has higher child poverty, than virtually every other rich country. In fact, it has higher child poverty than Latvia and Lithuania. And that's likely to damage early child development, which will likely have an adverse impact. And I point out to them that a 15-year-old male in the US has 13 chances out of 100 to die before the age of 60. Is 13 out of 100 a lot? Well, it's double the Swedish level. It's higher than in Costa Rica and Chile and Cuba. It's the same as Georgia. As I say to Americans, I do not mean Georgia. I mean the place where Tbilisi is, not where Jimmy Carter comes from. So I congratulate them. It's about the same as Georgia. The probability of a 15-year-old surviving to the age of 60 is lower in the US than in 49 other countries, and they spend the most on healthcare. So instead of having a discussion about whether you want high tax or low tax, how about having a discussion about high rates of child poverty, about adolescents who are damaging themselves with suicide, with drugs, with alcohol, and this is the average I'm talking about. And then ask, what sort of society do you want? So I'd rather approach it that way, and then you can decide, well, what the taxation rate should be and who should pay and the like. So starting with, there are these ghastly health outcomes that tell us something fundamental about the nature of our society.
Yeah.
And that's what we should be addressing. And then we can discuss the means to get there. Now, my own view is that closing Sure Start children's centres, cutting social services to the elderly. I mean, the Prime Minister was embarrassed because he asked his Conservative council why they were cutting frontline services. And they said, Prime Minister, because you've cut our funding by 37%. Well, there's only so many people you can fire before you have to start cutting services. So my own view is services for young children, for the elderly and the like, are really quite good ways for society to spend money. But it's not the money per se, it's what you can do.
But I mean, politically, this is important, and it isn't. It is sort of divisive too. I mean, you mentioned the Sure Start policy, which the current government ended. You also mentioned at one point that a finance minister or a chancellor who is setting a target to reduce child poverty is going to have a greater impact on health than the health minister might have. And you talk about the kind of things you might do if you want to if you were trying to actively increase inequality, and with it health inequality. Some of the things you might want to do are transfer publicly owned assets into private hands, be complicit in low general rates of income growth, but engineer the economy so there are runaway salaries at the top, make taxes on income and spending less progressive, etc. Now, it just struck me that, I don't like to read between the lines too much, but I mean, the only way I can make sense of that is, on your view, current government policies are making people ill.
political, moi. Perish the thought. My line, and it's a difficult line, is that I'm a health person and I'm going to analyse the likely effect on health and the distribution of health of policies. And I think policies that increase income inequality and reduce public expenditure, other things equal, will have an adverse impact on health and on the fair distribution of health. And I come at that from the evidence, not because I think Labour parties are always good at tax and spend and Conservative parties. I mean, I actually quote in that same chapter, say that the traditional view of politics in Britain is that parties of the left invest in public services but are terrible at managing the economy. Then the public get tired of the economy not doing well, so they vote in a party of the right that's good at managing the economy and is terrible at public services, and the public get tired of the shoddy public services and the pendulum swings back. And I say now we seem to have parties that can screw both up at the same time. And in the US, nothing happens at all because of the gridlock between Congress and the president. But so my way through all this is to say and that we need a vibrant economy and we need a healthy private sector. There's no question about that to deliver wealth, the economy. But a healthy private sector with an underfunded public sector is not the way to go. And surveys in both the US and Europe, when people are asked, what is the major problem facing the world today? They say too much inequality. So come back to what you read out and quoted. Yeah, I think we do have too much inequality, and I think that government policy is promoting inequality, and that's a bad thing. And that's not because I want to tell people don't vote for the government. I'm saying the government should change policies because they're likely to have an adverse impact on health equity.
Okay, well, you should see if they hear that and do anything about it.
Yeah, they'll probably cut my funding.
They cut everyone's funding. Time is whizzing by, and I do want to get the audience in, but we're here at the Festival of the Future City, and I know that a lot of your work is, we've talked about national government, but a lot of your work actually involves city level and community level, and there are cities which call themselves Marmot cities because they're taking up the recommendations of the report that bears your name. I thought it'd be interesting to spend a little bit of time taking your thoughts on what a city like Bristol can do, irrespective of what national government is doing, to try and deal with these issues. Because it might seem that the causes are too distant for us to do anything. I mean, there are 4 different areas you talk about, in particular, community groups, the importance of physical environment, making cities age-friendly, and also around housing. Now, of course, we don't have time to talk about all of those, but if we got you at a tete-a-tete with the mayor for a few minutes, what would you want to tell him?
Well, when I went to Coventry, which is wanted my permission, as if they needed it, to declare themselves a Marmot city for another 3 years. They've been a Marmot city for 2 years. And I was hosted by the political head of the council and the chief executive. And so we did talk about a lot of things. I said something surprising to them, which was to tell them, which I write about in the book. I write about Merseyside, but subsequently the West Midlands Fire Service read about what I'd written about Merseyside, and they said, come and see what we're doing. Fire and rescue service? Your job is to put out fires, isn't it? They spend 6% of their time fighting fires. The rest of it, well, they claim, okay, if you have shift work and preparing and polishing your boots and so on, it's maybe half their time. What about the other half of the time? The West Midlands Fire Service produced a report, Improving Lives to Save Lives, applying Marmot principles in the West Midlands Fire Service. So a woman firefighter got up and told this story, that she was called to a flat of an elderly man because there'd been a fire. By the time she got there, the fire had gone out. And it turned out it was a man in his 80s who lived by himself. And she tried to get in to see him, and he wouldn't let her in. And she tried for 3 weeks to convince him to let her in. She thought it was her responsibility. And finally, she was allowed in, and she said, "Why did you have a fire?" And he said, "I was cold." "Don't you have any heating?" They turned the gas off. She said, "What do you do here?" He said, "I don't do anything." "Do you watch television?" "I used to, till they turned the electricity off." "Do you see anybody?" "No." He occasionally walked down to the corner store to buy some tea bags and sweet biscuits. So she got busy. Her dad, the firefighter, got busy. Her dad wondered where his old clothes were going. She clothed this old man. She cooked him Christmas dinner. She got the medical people to come and sort out these manifold medical problems. She figured out he had a sister who lived 3 miles away, and neither knew of the other's existence. Eventually, she got him rehoused. And what the firefighters were saying was make every contact count. They got involved in helping young kids. They get the kids to come and play in the fire station and grow vegetables in a vegetable garden. Older people could get access to the gym in the fire station. They gave them, smart cards so they could get into the gym. They were involved in community development. So then you say, I'm a bit confused now about whether firefighters are acting like a charity group or whether they're government or what they are. I'm a bit confused because they're clearly getting outside their normal role. They were terribly worried if people found out how much good they were doing for the community, their funding would be cut. So they were really a bit worried. But I then talked to the city council saying, look at what the fire service is doing. They're starting at the beginning of life with children, going all the way through to the older age, and they're trying to improve people's lives. Now, you need money. There's no question you need money. You can't do it without money. And councils that are facing 40% cuts are going to find it very difficult to do that kind of thing. But the firefighters are saying there's a great deal we can do. Get children off the streets doing more interesting things, help children with education. They go into somebody's house and they say, how about fitting a smoke alarm? And people say, smoke alarm? I've got a leaky roof. And they say, you can get a grant from the council to help you fix your roof. Really? That sounds incredibly complicated. So these burly firemen with things on their shoulders, stripes or whatever they had, and these become social workers, and they help people negotiate their way through the myriad of council stuff to get a grant to fix the roof.
That's really interesting. The other thing you do talk about that's very important is people, you mentioned it in your introductory remarks, their sense of agency, autonomy, ability to do things for themselves. That's extremely important. There's always a bit of a challenge then when sort of governments, national bodies, even councils try to do things for people that even though they have good intentions, sometimes it can have the unintended effect of actually making people, reinforcing their sense of helplessness. So you say it's very important that you have to involve community groups with this. How might that work in practice? In the fire service, it seemed to be a genuine kind of bottom-up thing. It just occurred. But how do you help create the conditions for that?
Well, think about your own lives. You don't want somebody telling you what to have for breakfast or dinner or where you should go in your leisure time or any of that stuff. As the Swedes say, our responsibility is to provide a dance hall, but not to make people dance. So you want to have the amenities, you want a well-organized community, which we don't expect people to do for themselves. Not everybody has to be involved in fixing the potholes in the pavement outside their house. That's not a personal responsibility. We want older people not to fall over, and we expect the council to fix the potholes so that it's safe for older people. And we'd like the stairs to be not too steep, and we'd like them to have handrails and the like for older people, and similarly for children or mothers with babies and the like. We want all of those things that the community has to sort out, including reducing fear of crime, building social capital and the like. And we want to create the conditions so that then if somebody wants to hang glide off a building or a bridge or something, I think it's a pretty stupid thing to do, but it's not up to me. If they want to take risks and do those things, it's up to them. I don't feel the same way, and I write in the book about Jimmy in Glasgow, when Jimmy in Glasgow, a bit like LaShawn in Baltimore, who mother had multiple partners, they moved house about every year, he had behavior problems. By the time he got into prison for the first time, he had attracted a label of 2 diagnoses of mental illness, and he drank and smoked and did drugs and was abusive to his girlfriends, and he was a mess. To say Jimmy's got personal agency, he could give up smoking and stop doing drugs and get a decent job, is to ignore his tragic life history. But if Jimmy had a stable background and good education, and as I say, then chose to sit under the Glasgow equivalent of the Yum Yum tree, that's up to Jimmy. And that's not our responsibility. He's exercising personal agency. And that's what I mean by creating the conditions for people to take control of their lives. The good bits of Bristol are just absolutely terrific. That's what Bristol as a city decided it wanted to do. If people then come out and enjoy it, well, that's because they're exerting agency. They're choosing to dance on the dance floor that the community provided. So I think these two intersect.
Okay, let's provide a dance floor for a different kind of dance. We have the microphone here. Please do wait till it comes to you. In fact, is it just the one microphone? That's fine. Can I actually get you then to sort of like notice who wants to ask a question and go round? You do need to speak into it for training and quality purposes because of it being recorded. So who would like to go first? And if I could also just ask, so you can select. Yeah, I'm excited agency. If I could just ask contributions to be, if possible, brief and replies brief too, so we can get through as many as possible.
I'll be very brief. Would universal basic income help?
I think universal basic income would help because in response to Julian's question, I said there's much more than income that's important, but at the lower end, income is vital. And we talk about minimum income for healthy living, having enough money, the minimum necessary for a healthy life. So if everybody had the minimum necessary for a healthy life, it would help enormously at the lower end.
Okay. Next person, please.
Michael, you talked about the graduation in health and tracking income. In the book Spirit Level, they record how in the countries which have greater equality, the health outcomes are obviously better, as compared with those with extreme inequality, where surprisingly the disbenefits of inequality affect not just those at the bottom of the heap, but also the rich. And there was an article recently that said that the 1% are making their way to psychiatrists to be counselled for their bad feelings of rejection by society. One's heart bleeds, does it not?
Okay.
Yeah, the poor dears. I don't find that. What the data that I look at and that I cite in the book is that the people at the top are much less affected by the general societal impact. the impact of inequality in society and other societal factors increases as you go down. The poor are more affected than people at the top. I have some graphs there on life expectancy by education for 15 European countries, and the people at the top are much less affected than the people at the bottom. So it's some difference in the empirical findings.
Okay, thank you.
Still in this corner, I'm afraid. Has anyone calculated the economic cost of this inequality? Because it seems to me that this government particularly must be making a decision that it's worth that level of cost. When you think of the demand for mental health services, which is unmet, and the simple cost of those people who can't function because of government policies. And then there must be two intersecting graphs, and you choose what level you can tolerate. You're on top of this, obviously. So.
Yeah, we did calculate it when I did my English review for the government. We did calculate the costs. I didn't believe it. As I've discovered, if you bring in tame economists, you can get any answer you like. And we wanted an answer that said the cost was astronomical and the cost of doing nothing was just insupportable. So they gave us the answer we wanted, and the cost is enormous. But I don't really believe it. I think the reason for taking action is a moral one. We don't elect governments to save money. That's not why you have a government. Oh, we're the government that will save money. No, you don't. What we want is a government that will create the conditions for people to flourish. And the way I measure that is health and the fair distribution of health. So although I can make the economic case, I don't believe it. I don't believe that's the real case. The real case is a moral one.
Yeah, it's very interesting. Over here, yeah.
One of the things that concerns me really is that to a certain extent the rich have this sense of entitlement.
Yeah.
They don't like to get rid of their money, and actually when we look at who donates to charity, on the whole, you know, sort of on a street giving level, it's people who actually haven't got very much money who actually do the donating. What concerns me is that very much the upper middle classes have sort of taken away the ladder up, so to make society more equal. What's your views on that?
I mean, what we're seeing, two things. What we're seeing in the US, the rich somehow didn't expect the government or the public sector to provide anything. So there's a tradition of philanthropy, you know, Bill Gates and Warren Buffett and, you know, Rockefeller, Ford, Carnegie and the like. So the robber barons said at some point we have to give back to society and gave vast sums of money. It took an American in Britain, the Welcome, to do something like that. But on the whole, we don't do that. So our rich expect government, the public sector, to provide these things, but they'd rather not pay taxes to pay for it. So we don't have we're heading to American levels of inequality without American-style philanthropy. So it's the worst of both worlds. And the idea, this sort of self-justification that we're paid what we are because we're worth it. Well, I mean, really. And the public don't believe it. And I quote in the book, the National Centre for Social Research, the British Social Attitude Study, did a survey, and they do it every 10 years or so. They ask people, what do you think an unskilled factory worker earns, and what do you think the chief executive of a large corporation earns? And then they tot it all up and get the average. And people think that the chief executive of a large corporation earns 12 times what an unskilled factory worker earns. Then they ask people, what do you think it should be? And they think it should be 6 times. And 10 years ago, the same survey, they thought the ratio was 10 times, and they thought it should be 5 times. So they think it's 12 times. The real ratio is 360. So I take from that the British public are not egalitarians. They do not think everybody should have the same. They think the guy at the top should earn 6 times what the guy at the bottom earns, and he gets far too much, and they have no idea how big it is. They think 12 times is too much, and it's 360. So how anybody can justify that they're worth it, it's very anti-democratic. It's not what the population thinks it should be, and we're not doing anything to try and redress it.
So I was curious then as to why then, in recent elections, the parties which have seemed to be closer to this ideal have not done so well. And is it partly because there's been a successful kind of rhetoric of trying to claim that the policies which are less interventionist are on the side of hard-working ordinary families, that it is about rewarding effort? Somehow people have bought into the idea that, you're rewarding effort on one side and you're rewarding shirking on the other.
John Kenneth Galbraith said a generation ago that the rich aren't working because they don't have enough money, and the poor aren't working because they have too much money. So reduce welfare payments to the poor and reduce taxes to the rich, and you'll get everybody working. And that's what we've done, and which seems a bizarre way to go about things. And I think, and this is now beyond what I wrote about in the book, but I think what's happened is that the window of what is acceptable has shifted to the right. Margaret Thatcher was once asked what was her proudest achievement, and she said, Tony Blair. Because the window of what... So Jeremy Corbyn is being painted as some sort of Marxist because he's anti-austerity. There is no mainstream economist that thinks austerity is good for economic growth. The OECD published a report recently that said too much inequality is bad for growth. So, the mainstream economists say that what we're doing is wrong. It actually contradicts mainstream economists. But when a politician says that, he's painted as a Marxist. It's bizarre. So the whole window of what is acceptable discussion has shifted. Anybody outside that window is seen as dangerous. So being in the middle of that window makes you look like you're in the centre. But you're not. You're far to the right in economic terms. So our economic policy is way outside the spectrum of what mainstream economics thinks.
I think you have a question from the far left. Right here.
You could say that, I couldn't possibly comment.
Is there a natural Machiavellian point of inequality which prevents rioting but preserves the elite? And if so, what can we do about it?
Well, I'm by instinct a Democrat. I don't mean large D Democrat, American Democrat, but I believe in democracy. And I think, the population's pretty happy with 6-fold difference between people at the top and the bottom, and we've got 360-fold differences. So we could get down quite a bit further towards a 6-fold, and we do a lot better. But to come back to the earlier question, it's not just about the magnitude of inequality. It's about also what people can do at various points of the gradient. At the bottom, it's about having enough money just to lead a healthy life. And at various points in the gradient, it's not just about money. The question Julian asked me earlier, it's about what you can do. And that, to bring it back to the question about the city, a lot of that is determined by what we do at a city and a local level. So that I don't think we should just focus on income inequality. I think that's not quite a diversion, but that's not the only question. That's not all of it by any means. It's how we want to use the money we have as a society, and we have an enormous amount of it. There's a great deal of money sloshing about. We could do anything we wanted with the amount of money that's sloshing about. We're really, 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 really rich. And anybody who tells you otherwise is not speaking from the evidence.
Okay, I'll tell you what, 15-second question and a 30-second answer. I want to get one more in. Well, was somebody there? Wasn't he down here at the front? I've been waiting quite a long time.
Hello, I just wondered what role limiting how much we provide to those at the top plays.
Sorry, limiting?
How much we provide to those at the top. So, for example, Sure Start has been criticised because people who don't really need it were using it.
Oh, okay. So the problem with something like Sure Start is that you offer it to everyone, but it means people at the top get it as well. This is a problem with universal benefits.
Well, so I'll try and do it in 30 seconds. I think what I learned from the Nordic countries is the importance of universalist approaches. A set of services, a health service for the poor is a poor health service. An education service for the poor is a poor education service. The reason that Finnish schools do so well is because it's a universal service. But they work harder to get the kids who are disadvantaged up to the average, to include them. And it's what I call, forgive me, proportionate universalism. In other words, it's a marriage of the idea of focusing on the most disadvantaged, but having a universalist service. The NHS is a universalist service, but effort is proportionate to need, not to socioeconomic level, but to how much illness you've got. So I think there's a good empirical justification for having a universalist service with effort proportionate to need, which means offer Sure Start to everybody, but work harder to make sure it's benefiting the most disadvantaged.
Well, actually, made note of this. You say the evidence you cite in your book says that the more generous the social spending of the country and the more universal, the lower is the national mortality rate. And furthermore, the evidence is that such policies are pro-economic growth, not anti. So there you go. All right, now, we have run out of time. Sorry, inevitably can't get everyone's questions in. Michael's going to be with his books, signing them at the other end of the corridor towards Watershed 1. And a nice little gesture towards equality, they got some of my books there as well. But there is, on this occasion, there is no contest. I recommend Michael's books, and if you've got money sloshing around like the society as a whole, you might want another one. But certainly, it's well worth it. It's very rich, extremely, utterly compelling. I find it hard that the case can be disputed by anyone. And I suppose, generally speaking, people don't dispute the findings. Just when they don't like them, they just ignore them. Yes. I think that's probably it. So please make sure Michael can get out first before you try and get through the door. Before we do that, could I just ask you to join me in thanking him?